The pandemic has brought added stress for pregnant women and new parents with babies who can't be vaccinated yet, and mothers who faced stringent mitigations and hospital protocols during delivery.
This evening, WGN's Dana Rebeck has an in-depth look at pregnancy during this pandemic and the mental health crisis it has created.
Tonight, we examine the impact COVID-19 has had on pregnant and postpartum women during the pandemic and revisit one mother who nearly 2 years later is still deeply affected by a traumatic birthing experience.
Be a dinosaur.
He is really amazing. He's really funny.
What's Hulk Hogan do?
Carrie and Cody Belcher of Lake in the Hills are blessed to have a healthy and happy baby boy named August. He will turn 2 this May.
Probably my favorite thing about being a mom would be just the intuition, the strength that comes behind it. Anything he needs, it's like I already know. And he's my life.
Carrie is still very emotional today because for her, becoming a mother was not an easy experience. Both she and her husband tested positive for COVID-19 in the week leading up to the delivery.
I'm still, I might not be able to touch my son for another 2 weeks.
Due to restrictions at the time, Carrie had to give birth to her first child alone, Cody watching over FaceTime.
Helpless. Just helpless. I wasn't able to do anything. All I could say is stay calm.
Carrie remembers the brief moments before the nurses took her baby from her. She wasn't able to hold or nurse him.
I remember speaking to him. That was hard. I just wanted him to hear my voice. Because I knew once he left that room, he wouldn't hear my voice anymore.
A painstaking separation doctors had to enforce during this early stage of the pandemic.
So initially we stopped having any visitors on the labor suite. We stopped, if a mom tested positive for COVID, we would take the baby out of the room, trying to prevent the baby from getting COVID.
Dr. Lauren Carlos specializes in high-risk obstetrics at Northwestern Medical Central DuPage Hospital in Winfield. She's been working here since August, but started the pandemic at the University of Pittsburgh Women's Hospital, where she recalls one particularly difficult case, a patient in the ICU with COVID at only 24 weeks pregnant.
But eventually it wasn't safe for her or the baby, so she got delivered when she was completely sedated and on the ventilator, and had to be transferred out for something called ECMO, which is a complete heart and lung bypass machine.
Fortunately, both mother and baby survived. Since then, we have covered similar cases in our area.
She was complaining of loss of breath and chest pains.
Back in September, we met Donnell Kelly of McHenry, whose wife Samantha was fighting for her life at Advocate Lutheran General Hospital, put on a ventilator for nearly a month. Doctors delivered their son Holden by emergency C-section at 32 weeks when Samantha was sedated. Eventually, they were released and able to go home and are now doing well.
Once he was able to start nursing, we started nursing. We were nursing and bottle feeding.
Then there was the Olison family. Jessica and Jesse's baby boy Jay was born on December 27th at Northwestern Medicine Prentice Women's Hospital at 38 weeks. They knew he would require surgery after birth for an intestinal hernia and fluid on his brain. 9 days later, before being transferred to Lurie Children's Hospital for surgery, baby Jay tested positive for COVID-19 during a routine swab. Jessica did as well, and doctors told her she had to leave Prentice and couldn't see her baby for 10 days.
To even hear that was just heartbreaking.
We are trying to protect all those other premature babies, so it's just a tough situation.
A fine balancing act to reduce risk of transmission. When it comes to pregnancy during the pandemic, the stress seems to be taking its toll. According to the National Center for Health Statistics, many couples are consciously now choosing to delay having children. Births in the United States have generally declined about 2% per year since 2007, but the U.S. saw the largest dip from 2019 to 2020, where births declined from 3.8 to 3.6 million, a 4% drop. The largest reductions in births were seen in New York, California, and New Mexico. Their births dropped by 11%. Job uncertainty and ongoing health concerns over COVID-19, reasons women are choosing to wait. Pregnancy putting women at higher risk of serious complications. According to the CDC, symptomatic pregnant pregnant women are more than 2.5 times likely to require ICU admission than women who aren't pregnant, and nearly 3 times as likely to need to be put on a ventilator. Then there is the mental toll.
I remember those first few months. I was breaking out in hives before going to work. I would go to my mother's about an hour before work, just so I would have that time to transition.
Separation anxiety that continues today.
I mean, we're still dealing with the effects from it.
That's not surprising, unfortunately. There is a lot of information on birth trauma and the postpartum period.
A worldwide study by the T.H. Chan School of Public Health at Harvard found a major mental health crisis among pregnant and postpartum women. Nearly 7,000 women from 64 countries were surveyed online. Among them, 31% reported experiencing depression and anxiety, compared to just 5% before the pandemic. And 43% said they believe they have post-traumatic stress disorder related to COVID-19, compared to just 6% 3 years ago. And 86% of all women surveyed said they were somewhat or very worried about COVID. Research that has changed hospital policies across the country and in Illinois.
Eventually, we started to take into account not just the infection risk, but also the psychological risk of delivering a baby without your support person by your side and not being able to bond with the baby in those first few days.
Northwestern Medical Central DuPage Hospital now allows 2 support people in the delivery room and does not separate COVID-19 positive mothers from babies at birth.
I would not want anybody to go through that. Not holding your child right after they're born is life-changing.
The Belchers thankful these policies have changed. They do want to have more children, but like many Americans are holding off for now, waiting until things feel a little safer. But when they're ready, they're dreaming of something much different.
To be able to go through, I guess if you want to call it a normal birthing experience, and to have him in the room with me and then have him go pick up the kids and bring them in to meet the new baby would be... Say hi. It'd be amazing, an amazing feeling.
The Illinois Department of Public Health has been tracking the number of women testing positive for COVID-19 at delivery. The latest data shows from March 2020 to March 2021, there were nearly 1,500 positive cases. Doctors encourage any postpartum women struggling with anxiety or other mental health concerns to seek counseling. We do have a list of those resources on our website at WGNTV.com. Dana Rebick, WGN News.
Incredible challenges for those new families.